Hello and welcome to Living a Culture of Life podcast by Human Life International. I'm your host, Colleen, and I'm joined today by Camille Kiefel. Welcome to the podcast.
Yeah, thanks for having me.
I'm really excited to have you on today. And
Yeah.
Camille is a detransitioner, and she'll be sharing her story with us today, and we'll discuss this topic a little bit more in depth. So, Camille, let's just start. Could you start by sharing your story with our audience? And then if I have any clarifying questions, I'll ask those.
Yeah, so pretty much like many detransitioners, I was struggling with trauma. I was struggling with mental health issues, ADHD. I had trauma around, I wanted to protect myself. And so there's that aspect. There was concerns around being a woman and growing up. And so this started happening when I was in sixth grade. I started to dress more masculine. And then in college, I was a women's studies minor. And I was introduced to the idea that I could be non binary. And so I struggled for years and my mental health wasn't improving, even though I was doing all the right things. I went to the DBT Institute, which is dialectical behavior therapy. I, um, I was seeing my mental health professionals. I did like a DBT or not DBT, but I did like an ADHD work class, like workshop. It was like, well, kind of a group. So I was going to that weekly. I really wanted to get better. I was trying all the medications. I wasn't responding well to the medications, and I was considered treatment resistant for my depression. And I actually qualified for 2 rounds of transcranial magnetic stimulation therapy. They put a helmet on your head, and they use magnets to stimulate your brain. Um, and I qualified for that because I was really struggling when it came to improving my mental health.
And
So,
this was like for ADHD and depression, not for struggling as not for identifying as non-binary, right?
right. So this is for my mental health issues. But I was dealing with all these mental health issues on top of dealing with the gender issues. And I'd gotten to the point where my mental health had deteriorated so much that the only thing I hadn't tried through the conventional medicine model, other because I tried like the medications, TMS, I tried traditional talk therapy, dialectical behavior therapy. I tried everything. And so I was still really struggling and I needed something to get better. And so the last thing I hadn't done was to transition. And I still thought I was non binary at the time. And so I reached out to my doctor. I'm like, I don't even know if this is a possibility because I'm not, you know, I don't think I'm a man, but I think I'm non binary. I don't know if this is an option. So he connected me with somebody and then they connected me with these different resources. It happened within, I think it was like 6 months, which is crazy that it happens this quickly.
Yeah.
Um, yeah, within 6 months, they performed the surgery on me, which is a non binary top surgery, which is bizarre to me because there's actually no non binary sex to transition to, and yet they still performed the surgery and they considered it a medical necessity.
Is that surgery any different than the surgery someone would have if they thought that they were male when they're actually female? Or is it the
No,
exact same surgery?
there's different surgeries. So it was a mastectomy, and there's different ways of performing the mastectomy because there's different ways of cutting that they use, nipple grafts and stuff like that. Like all that can be done differently. So the thing with these surgeries that's concerning is that there's not one type of surgery. It's not like we have a medical diagnosis of like this person believes they're this and this is the exact surgery we do. It's very customizable. It's designer, and it's concerning because if you were to come in like with a heart issue, like and your doctor diagnoses it and then they figure out like, okay, this is what surgery you need. Um, that's going to be there's an exact thing for that. But when it comes to these trans surgeries, it's not like we know, like I said, like they transitioned me to a non-binary sex, which doesn't exist in nature. Like there isn't a blueprint because they would consider that transphobic. And we've tried to discuss this with the WPATH, and WPATH won't respond to us. They won't respond to us about concerns about the populations we're seeing impacted by this either.
Yeah, I'm sure. Um, so how did the doctors and your therapist handle your decision to transition? And how do you wish that they'd handled it? What do you wish that you'd heard at that point?
Yeah, so how they handled it was completely patient led, which is surreal because in any other case, the doctor would be, no, we don't think that this is the issue. This is what might be the issue, or we need to try this, then, set it out and wait. It's just like it's surreal because nothing else in the medical field is handled this way. Nothing
Mm-hmm.
else is, I think I have this condition. You must perform not you must perform the surgery on me, but like in my case, it was just like, I was like, hey, I think I have this. Like, could we look into it? And then it was just, yes, 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 not like anybody actually investigating it.
Mm-hmm.
Like there was, and the problem is too, is that they say like you can be trans and have trauma. Well,
Mm-hmm.
what we're finding in the detransitioner population is that a lot of them have trauma, and that's why they transition.
Mm-hmm.
There's a lot of escapism, you know, a lot of people that they just don't want to be who they are, and it's just too. There's a lot of ADHD and autism
Mm-hmm.
in the detransitioner population as well, and yeah, it was weird because I remember getting a phone call saying that you need to fill out another form. So I'd seen a therapist through Bravespace, and this therapist signed off on the surgery. And then I get this call saying, okay, you need to get this letter saying you're psychologically fit to do the surgery. Well, in Oregon, this isn't normal. So somebody along the line saw something wrong, but instead of talking to me about it, they were like, oh, well, you just need to get this letter. And they acted like this was a normal requirement when it's not.
Interesting.
So yeah, it's concerning because I was in a really bad state back then, but everybody signed off on it. And what I really needed was to address my physical health, but nobody was going to do that because once they think that your problem's a mental health problem, they don't want to look into it. I was just talking to somebody recently, and she was saying how she has like a genetic issue,
Mm-hmm.
and they were giving her medications for anti-anxiety, and she just has a heart condition. And so it's like they don't investigate it. Like it's like, again, like there was a young man reached out to Detrans Help, which is the nonprofit I'm president of, and he was saying like, I want to opt out of gender. I want nothing to do with sex. Talking about he struggled with obesity and depression. And the first thing they're recommending to him is to transition. They're not checking all his other health issues because there are health issues that can lead to poor mental health. And I had no idea that this was the case because everything for me, I've been treated like, oh, well, you just need to see another psychologist. You just need to see another psychologist. You need this medication. Nobody's like, oh, well, did you try adding meat back into your diet? Did you try, because I like at one point I had really low vitamin D, started taking vitamin D supplements, and I start feeling better. It's like, there's just like little things that, you know, I think we've become so disconnected from our body and like what we put in our bodies that, and I think it's led to where we're at with this sort of transhumanist medicine model as well. And I just, I'm very concerned because I know like in kind of this space, there isn't a lot of talk of the physical aspect. And there's even a possibility that a lot of, well, it's like kind of surreal because I remember like they're talking about forever chemicals and they're like, well, this actually might be why we're seeing a rise and they're like, it was like a pro LGBTQ
Hmm.
um, like video. It's like kind of weird. It was like, well, maybe that's a good thing we're seeing a rise because of forever chemicals. I'm like, what happened to, like, this is the way we are, like we were born this way, like this is synthetic, like this isn't authentic. um but that's not really been a part of the discussion either. But we don't, the reality is we just don't know all these things. We're just seeing lower testosterone levels in men generational wise, and it's like that's not being looked at. like like maybe instead of like putting him on estrogen, maybe he needs to be on testosterone. Like I don't know, I'm not a doctor, but it's just like this isn't a part of the discussion, and it really should be. Of like, well, maybe there's other things going on other than just, well, this is a mental health issue. And yeah, it's definitely concerning to me.
Well, and also an ideology. It is like the pet ideology of today's culture. And if you question it, then you're a bad person and you're a transphobe. And instead, people that are questioning it are seeing serious mental health problems and physical problems and think that children shouldn't be operated on or mutilated just because of something that they're struggling with that could be fixed by helping them with X, Y, or Z in their physical life or their mental health life.
Exactly.
You said that a lot in the trans community and like the detransitioner community, both of those, obviously because they go together, there's a lot of ADHD and autism. Do you have any idea why like those go together?
I'm wondering if that's partially a fixation thing.
Okay.
That might be part of it. Like I know for me, I have a little bit of a dissociative aspect. I don't feel like I fit in really. Um, like I'm not, and maybe that's part of it. Like I know like there was a girl with autism. She was interviewed for Vice, um, which is kind of a surreal video because they had like a trans individual like recording it, and it was sort of like that the detransitioners were an issue, and yet interviewing this young woman who was like, I sought this out and my problem was really with my struggle with autism. I just know for me it's just like and having ADHD, I guess it's just feeling out of place, feeling like there's something wrong with me, and like being too sensitive, and or being told that my whole life, like, oh, you're too sensitive, and not fitting in. And so maybe that's part of it. Like I said, it's hard to say. There was a study done that was, again, like another pro LGBTQ study, but it wasn't concerning because it was like, I think it was like 6% of gender variance came from ADHD and 7% came from autism. So it's like really almost like neck and neck. But yeah, the ADHD part doesn't really get talked about. I think too, a lot of people don't think it exists. And the thing is that we don't we don't know why the symptoms present the way. There's a lot of overlap. Like I've been told multiple times, like, oh, has anybody told you you might have autism? And this is what therapists tell me. And I'm like, and they go through the autism list and they figure out I don't have autism. It's just, and I also tell them, I'm like, oh no, I actually have ADHD. So there is some overlap between the two conditions. They're not the same, but I think it's that overlap that's causing some issues. But yeah, that's another concern is that individuals with ADHD, like that won't be really investigated because it's not a popular topic to
Mhm.
discuss when it comes to detransition.
Oh, for sure.
Yeah.
Um, I had another question. Oh, I remember what it is. So it seems like I haven't done a lot of research on this subject, but it seems like from what I've seen online, common factors leading people to transition are, like we just said, autism and ADHD, um, some type of trauma in their past, and then online social media, things like that. Did the social media online aspect play any role in your decision to transition?
It didn't as much. And I think part of it was that I'm 34 right now, so I'm older. And it's interesting to me because, again, like this happened, like I was experiencing some of the similar things. Like this happened when I hit puberty. Like, so it's like the ROGD. Like the same things was happening to me. I think that the social, like being exposed to it is something like you have to find out that this is a possibility to even like consider these surgeries and whatnot. I think part of it may be that it's what the type of population.
Mhm.
Like we see a lot of anime in this, like a lot of anime watchers, like I enjoy anime, um, and manga. It's just like that's kind of like maybe a little bit more the nerdy kid, like maybe the creative kid, like somebody like for me, like I really enjoyed the thoughtfulness that I would get out of manga that I felt like I wasn't getting out of Western media. Now you know, I've expanded that. Like I watch film and stuff as well, but it's one of those things too. Like you obviously there's thousands of anime fans and they have no interest in transitioning. So I think it's partially a subsection of a culture, you know, it's just like it's more of maybe a perfect storm than rather than this exact thing is causing it. I think it's multiple factors.
Yeah. No, I agree that it's multiple factors, but it is interesting to like be able to pinpoint key things that show up in many stories just so parents can be aware and hopefully catch warning signs before it's too late. And not saying that if you have autism or ADHD, that's what's going to happen to you, or if you have trauma in your past, that's where you're going to go, but more of just looking, okay, this could be a warning sign. How can we like just be aware of what our child is watching online? I've also heard with anime that a lot of the characters can be very androgynous looking, and that can also kind of feed this mentality that it's better to look non-binary than to be male or female.
I think for me that was the appeal of anime manga, but I actually got into it because the characters were feminine. And
Oh,
then like when I became like more interested in like the non-binary androgynous, then I was more drawn to that. But the femininity actually got into it because what's interesting about anime and manga is that they had in like the 1970s, like they had women creating comics back then. And so they actually made their way into that industry versus in the US, I'd say it's probably happening more now. Not that there isn't women comic artists and artists like Alison Bechdel or whatnot, but yeah, it's there's definitely a lot there to be. I guess that appeals to a lot of people, particularly a lot of people who are struggling with gender.
that's interesting. Yeah, I haven't watched too much anime myself. I've seen like
Mhm.
Howl's Moving Castle and things like
Yeah,
that, but my knowledge of it is very minimal. So, how old were you then when you got top surgery?
I was 30.
Okay.
Yeah,
Interesting. So that's like a lot later than what you're seeing with a lot of the rapid onset gender dysphoria in today's day and age. Probably because when you were experiencing that in puberty, that wasn't a common thing that people went and did. Um, and
yeah.
interesting. What, how did that affect your mental health once you got the surgery? Did you have immediately regret? Did it like affect your mental health in a positive manner at first and then go downhill afterward? Like, what was your immediate like mental and physical response after having that surgery?
So it was difficult for me to even register what had happened because like right after the surgery, within days, I developed complications. So I had trouble swallowing at first, and then they did a swallow test, and the swallow test came back normal. And then it felt like the back of my neck was burning, and it was just like it felt hot. And then I developed scopolamine poisoning in this eye because I had a scopolamine patch right behind my ear, and they do that for nausea. And so this eye was dilated, and it didn't go away months afterwards, even though it's like supposed to be a month thing. So I would like it's supposed to last a month, but this was months and months afterwards. Like I would be meditating, I open my eyes and like, why are my eyes blurry? And then this eye would be dilated, but this eye would be normal. And it was just weird things like that. I developed bony prominences, like, and I never had an issue with that before. Skin discoloration. I just was really struggling. And my doctors took me seriously until they thought I had psychosomatic fever, and they stopped taking me seriously. And so I was pretty much left to figure out like what I'm going to do. Um, and it was tough. So I started seeing a naturopath, and then I started getting better. I saw Michaela Peterson on her carnivore diet. And then I started eating meat again because I've been a pescatarian, only for meat as game as fish for over a decade. Started feeling better, did like bodywork treatments, like stuff around the nervous system. Again, started getting better. So I was starting my recovery. And it was like weird because like now I'm like the most mentally healthy I am in my entire life, but I no longer have my breasts. And it's hard. It's like sometimes I'll just like I was walking like to and from like I was walking to a different location at work. Um and I was just like, oh, it's gone. Like it's just like it's weird and basic. Like it just like comes up randomly. Like I don't know when I'm gonna be thinking about it. It's like, why am I thinking about it at work? Like look in the mirror, it's I just these weird scars, and it's like what happened? Like why did this happen? And it's weird. I know like there's a lot of people who are like, oh, you need to take responsibility for what you did and stuff. And it's just like, yes, I requested the surgery, but I'm like, this is weird. Like this is like when I try and reach out to WPATH, I'm like, hey, like we're seeing a pattern of individuals who don't want to be gay. They'd rather be straight, and so they transition. We're seeing sexual assault survivors, like they're wanting to transition. We're seeing like the neurodiversity, like we're seeing these things. Like, let's just talk about it. And they're the guidelines. Like they're the ones that my doctors were looking at. Like we're trying to get this to working with legislation in Oregon, um, trying to get them to consider like this is an issue. And they're like, oh, well, detransitioners are covered. It's like, well, sometimes, like, I mean, I was looking at reconstruction surgery. Like, I'm terrified to get it because of all the complications I dealt with. But the first thing they say to me is that, well, you're a cis woman, so I don't think we can cover this for you. And I had to kind of like push on it. And then I couldn't get a therapist to sign off because all the therapists who are like, aware of this issue, they're uncomfortable about signing off on it. And so it's like, well, there are going to be roadblocks if you're a detransitioner, and they don't tell you that. Like they don't tell you that detransitioners exist. When you're considering the surgery, you should know who's not a good candidate for it. But there's not a good candidate for it. It's deeply concerning to me that there's a lack of discussion around, yeah, there's some people who should not have this surgery. And like maybe we need to step back and like reconsider this. But if you say that, then you're transphobic.
Yeah,
And yeah.
it's scary, the lack of, I mean, obviously I don't think that anyone should be going through having that surgery, but even if I did believe that, I would be concerned at the lack of conversation, the lack of making sure that somebody is mentally ready to make a big life altering decision like that. Like even taking away the moral issues or anything like that and just looking at it purely from how should the medical community be approaching people, even if you do believe it's a valid surgery. You need to like look at, is someone mental health? Do they have informed consent? What does that look like? You can't just people, it seems like, especially children and like not well, teens end up on this path right to surgery with no one ever questioning or challenging it because you can't. And that should be terrifying to anybody. And it, yeah, there needs to be looking into the reasons that people are getting it, what the common factors are. Are there other things you can do first? And not just putting people on a conveyor belt to a life altering surgery.
Yeah, I think that in the next few years, like this is going to be a huge scandal because they're going to look back on it and be like, you silenced the people who were trying to voice the fact that this is a serious issue.
Mm-hmm.
That people, I mean, yeah, like I said, it's crazy to me that there isn't, like WPATH explicitly says, like, we don't know that much about detransition. It's very rare. Well, we need to know what causes detransition. It's so weird because of the politics around it, but I know like I testified in Minnesota and like they were like, oh well, she's part of the narrative of the right. And it's like I'm a centrist. Like I'm on the center, like which drives people nuts too. But I'm in the center. Like that's just where I am, and I'm just gonna look. I'm going to take information, and I'm going to decide whether or not that information is good or not, and then kind of go from there. But it's just like it's so weird to be. There's just so fixated on that though, and it just like they can't get past it. Um, and then they just totally dismiss anything anybody says, like any concerns anybody has. We actually had somebody in Oregon and she wrote the original WPATH guidelines and they weren't radical enough for them. Like they did not actually take her guidelines because she actually did have some concerns. I did reach out to her, but she never reached out back. So it's tough. It's like you're trying to start a dialogue and be like, hey, like I'm seeing this. Like we need to like take a step back like before this gets worse. But it's there's so much damage that has already been done. And then it's just like because too, it's just like people detransition sometimes the minute they wake up from surgery, and sometimes it's gonna be 10 years. And so that's a huge span. And we should be like this focus should be on like providing the best medical care, but like that's just it's not on the table for them.
For the sake of our audience, I just realized we've been using the term WPATH and didn't really explain what that organization is. WPATH stands for the World Professional Association for Transgender Health.
Okay.
So can you explain for our audience what they do?
So they create, and they're currently on the standard of care 8. They might be on 9 now, actually, now I think about it, but they're on one of those. And they're creating the guidelines that your doctors are using, that insurance is using, like what I'm working on in Oregon. And the tricky thing is that it's very vague. It's sort of like, do as you almost like do as you please, but they particularly don't address the detransition issue. And this is a huge problem because, there's a lot of problems with WPATH, like the WPATH files like came out. And I don't know all the details of that. I think that they're sort of in denial of the fact that, well, can they really consent to this? Like, I think part of it is just like when you're so sucked into the ideology, you make excuses for things that you shouldn't be making excuses for. But yeah, it's a serious issue that they're very lax, and then they don't know what causes detransitions. They don't even know who's not a good candidate for these procedures because it's really procedure or patient led.
And it doesn't sound like they're very interested in listening to detransitioners at all, from what sounds like from what you've been saying.
No, it's hard because it's just like you got the email, you send them or like what is it like you fill out their form on their website. You're like, hey, like I just want to talk about this. I'm seeing these populations impacted by this because we brought up populations that particularly the gay population. We're like, hey, like we're seeing this in this population. Like let's talk about this, and never heard back. Yeah, it's just like again, they're just so defensive that they're not even open to hearing that this is a serious issue.
So you have the organization that's setting the standards for care, giving very vague guidelines, and then not listening to people who regret the surgery. And in a sense, it seems like they're kind of denying their existence. And that's the exact group that you would want to listen to know what the problems is with the treatments that with the like standards that you're setting for doctors. Like that's exactly I feel like who you want to listen to. If people have a bad experience with the standards of care that are being met, you listen to their bad experience and you figure out normally what can be improved. Obviously, in this case, I don't really think it can be improved, but at least like not rushing people into life-changing surgery. And that, yeah, it seems reasonable in any other like circumstance that you would listen to the people that have problems and say, okay, how can we improve this service that we're offering? And in this case, they're just denying your existence and going forward with an ideology.
Yeah, it's really concerning because they're just not listening to those who are harmed by this.
Mm-hmm. And that's always a problem. You need to be able to listen to the victims, to people that are harmed, and at least listen to their stories, even if they're like, again, in any other circumstance, even if there's nothing you can actually do, listening and giving them a voice and letting them talk is important. And the silencing of detransitioners is a problem. So, what did detransitioning look like for you? Was it simply waking up, realizing that you didn't want to be non binary and kind of moving on with your life? Did you like, what did that process look like?
Yeah, so I mean, I thought I was non-binary about a year and a half after I I I had or the top surgery was done, but um and then I started to my friend, I'm like, I don't think I'm non-binary anymore. It was like this weird, like, I don't think this is actually what I needed. And from there, I just like, well, it just wasn't the right thing for me. And then it was like when I started listening to other people, I'm like, oh, this is a serious problem. Like that's kind of like the switch, was that I was seeing that, you know, the standards of care were actually listening to the voices of those harmed by this, um, and whatnot. And yeah, so that's kind of what that looked like. But I mean, there's a lot because it was being full on like, really into the ideology to being like introduced to new ideas and figuring out too. I think that was the hard thing was that, um, it's just like I wasn't exposed to these different perspectives. And then I'm like, oh yeah, they're human too. But you're told like, oh, they hate trans people. They hate like, and so you're living with this idea of like, and it's just like it's really bad. It's really bad. It's concerning how they ingrain that. And I think it's been a long time. I think it's like sometimes it's dropped in media or, in the classroom and whatnot. It's really concerning. And so yeah, it was just like it was unlearning that, it's getting out of I do think that there are definite cult like aspects. And I think part of the problem too is that I didn't recognize it as a cult because generally cults look a little bit more religious like they have like more of a religious, like even if it like is about UFOs or something, like there's kind of that aspect of it. And
Yeah.
then this is presented as a these are like pretty much it's presented as fact more so like as even though like it's a theory and that's what it should be really fixate on. It's like this is a theory, this isn't fact. um yeah, it's really concerning because it is breaking out of a cult. I feel like it's unlearning that, and then it's it's like kind of coming to terms with like the things that I was dealing with, like with being a woman and whatnot, coming to terms with that. And I think that puberty is hard, and then it's also just vulnerable being a woman. So it's just like coming to terms with the fact that yeah, sometimes it's scary being a woman. Like
Yeah.
it's scary to be vulnerable, and you're not as physically strong as a man. And that was a hard thing for me, but I just like I needed to just come to terms with that.
Did that realization that you didn't think you were non-binary anymore, did that coincide with your health improving?
I don't think so. I mean, it might have a little bit, but I think a lot of, well, okay, I see what you're saying. Are you saying like, did I detransition partially because my mental health was improving?
Well, you were talking about how when you were improving your physical health, it
Yeah.
helped your mental health improve. And I guess I was asking if that like making like working on your physical health and like getting that like getting the nutrients that you needed, eating meat again, and the effects that it had on your mental health, did that lead to that light bulb moment where you realized that you weren't non-binary anymore?
Yeah, I see what you're saying. Yes, I do think that because of the fact that I addressed my physical health, I was feeling better. I think it did help me detransition.
Okay.
I know like most detransitioners, that's not their story, but that's for me, part of it was just like building up that strong foundation really helped me get
Mhm.
out of that.
Yeah, I know I haven't heard that from other detransitioner stories, but from what you were saying of how the physical health was a huge component for you, I was wondering, yeah, if that was your experience. And it makes sense that it is. Like as you become healthier physically and as your mental health improves, it makes sense that that would help you hopefully have a little bit more comfort in in your own body. And if I guess like if you're investing in your body's health, you have more of a connection to it and are going to be able to feel more at home in it and hopefully feel more at home in being a woman.
Yeah. And I think that too, just like I was just very disconnected from my body for the longest time. Like since I was 18, I've been disconnected from my body. So that was kind of like feeding into this whole
Mhm.
non-binary thing. And it really did help because I'm still not fully connected with my body. Like sometimes people will say like something, I'm like, oh, I didn't even feel like that. Like I didn't feel that emotion. So I'm still getting there, but I'm much better than I was 4 years ago when I had that surgery. So
Yeah, I'm sure. I mean, it's a process. All healing is a process. Having to confront past traumas, past like conceptions you had of yourself, past ideologies that you're realizing maybe aren't true. Like all of that is a process, and it's not usually like a light bulb goes off overnight and you're like, oh, I'm a new person. I'm different. I've healed.
yeah.
Did you
Yeah.
get any pushback when you were detransitioning? Did you experience any pushback from like your social groups or medical professionals?
Thankfully, I haven't. I've not really, I think the only pushback I got was when I requested to look into, like, I was like, I just want to see a doctor for reconstruction surgery and see what my options are. That was the only pushback I got really. I mean, I did talk to a professor and she was like, oh, it's part of your gender journey. A friend said that too. So I guess that, yeah, technically it was a little bit pushback, but not really in the traditional sense. It's like they're in the ideology and they're justifying it
Hmm.
type thing. You know, it's like, oh, you're cis, so you're privileged now. It's like, I don't have my breast. I don't know what's privileged about that, but you know, it's they just justify it. It's just like that's an ideology thing too. Just like it's just
Hmm.
justifying like, you know, it's that cognitive dissonance. That's what I'm looking for.
Yeah, I mean, it's the ideological framework that they have, and then there's something that doesn't seem to fit with that, and you
Right.
start trying to figure out where that fits in the framework that you've accepted. So that makes sense. Um, so you're the president of Detrans Help. Can you just explain for our audience what that is, how it helps people who have detransitioned, what your like goals are with that organization?
Yeah, so Detrans Help. So we are a nonprofit organization by detransitioners for detransitioners, and pretty much we are like we've done some testimony. We're bringing awareness to the issue. Currently, we're working with Oregon legislation. We're trying to that's the thing, right? It's
Hmm.
we're trying to get them to kind of like start a dialogue with us. We also check detransitioners with resources and those who care about us with resources. Um, and we have worked with some people who are questioning. You know, like that young man I spoke about earlier. That's not really the focus of our organization, but if there are people who are questioning and just you know want to talk to us, we're open to that. So but yeah, just we're pretty much providing resources and connecting resources with those who need it.
How prevalent is detransitioning?
I think it's really tricky because we don't know. And then also, like I was saying earlier, like it can take 10 years for someone to detransition. I know they talk a lot about girls
Hmm.
transitioning, and we do see a lot of girls publicly detransition. Most of the people, let me see here. I think everybody who's reached out to Detrans Help, I think there's like has been male. So I think that that's interesting too. So there are males who are struggling with this, but we're not seeing it publicly as much. We're seeing it on the back end. So it's like there's just so much we don't know. And maybe we know about the girls because maybe the girls are more public about it. Maybe there's more stigma around a male wanting to become a female. Like maybe that's why we're not seeing that. And then when they detransition, it's maybe more private as well.
Mm-hmm.
So there's just, and maybe they can get help, through social media. Maybe the girls are getting help through Reddit. Like we just don't know. Like I think that there's about 5 or 6 detransitioners in Oregon, like that I know of. And so
Mm-hmm.
that's not a small number. And then the thing too is that we know some of them pursue lawsuits, some of them don't. Like the one individual we're working with, because he's now gone back to his religion, and they don't want him to have any financial gain from the lawsuit. And so that's why he didn't pursue a lawsuit. And so this is another thing too, is that there may be a religious aspect to somebody not pursuing a lawsuit. There's also the being public about it. Like all these lawsuits are public record, and that's going to impact your work. Um, there's just a lot of reality, and then too a lot of like, and I've gotten some pushback from the right of like, you should have taken responsibility for this, which I was kind of surprised about, but like I get that. And so you're getting heat from both sides. So it's not like you're turning to one side and they're really helping you. I mean, I definitely feel like we're getting more support from the right, but we're also getting that pushback too. So, and really there's this really focusing on kids. And so like, which is important because like kids shouldn't be transitioning, like that just shouldn't happen. But that kid's going to turn 18
Mm-hmm.
and, see transition, and just like, I'm just seeing all the problems down the road, all the health problems from this.
Yeah.
No true informed consent. So it's just a very messy issue. And I see why detransitioners don't want to come forward, because you're just going to get pushback and you're not going to get support. In many ways, like you're going to get support from some individuals, but not from everybody. So it can be hard. And then too, like I'm seeing a lot of detransitioners are on Medicaid, so they're low income. And so they're struggling. Like I was doing a lot of this full time when I had, and I was trying to find work. I wasn't able to find work, but now that I have work, like I can't do this full time. So it's just the reality is that, yeah, I'd like to be more out there, but it's, I have to like, I want to get back on my feet. Like that's the main thing. I want to get back on my feet. I want to move on from this.
Mm-hmm.
But I also want to help people, but it was kind of like, I'm here to help, but I think too, just because I think part of it just not being a minor, um, impacted like the fact that they didn't want me as much. Like it's weird. There's like a lot of politics
Mm-hmm.
in this space, which is unfortunate.
It's more of a sob story when you have a minor whose parents like felt like couldn't say anything and then they're put on this track. Like it's a lot more of an emotional sob story. But I think it's really important that people like you are also sharing your story, because if you are struggling with mental health, it's going to diminish your culpability for things. You're not necessarily thinking straight. You're not necessarily having true informed consent to agree to these things. And I think having a reaction of, oh, well, you should just own up to your mistake is very harsh, and not recognizing the immense like mental, physical problems that were feeding into this and making you think that that was the only option for you.
Yeah, and yeah, I agree. Yeah, it's concerning because I hope that eventually we get to a point where people see like this isn't just about responsibility. It's also about like the corruption of the medical system, like not looking at the fact that providing better care should be what we're aiming for. And then somebody, we talk about low birth rates. Well, it's like, this is impacting this. Like, this is a big concern. And this population, like, they need to get to a place where they're in a healthy place where, if we're concerned about birth weight, we're going to have to look at this population too. And they're going to need to get the care they need. But there's a lot of work to be done. Like, the one thing I do give the left credit for is their discussion around systemic issues, like that there's an issue, kind of like the medical system.
Mhm.
Um, I think the big thing is, like, at the end of the day, they turn to, like, critical theory and as their solution, and that I really don't think that's the solution at all. Like, there's a lot wrong with the medical system, and part of that is the fact that there's like a one approach, one solution to a problem. And so, like, that girl that comes in with the heart condition, anti-anxiety medications, when it's like, no, she has a heart condition.
Mhm.
But somebody comes in with, or that young man, you know he was struggling with mental health issues. He maybe had low testosterone, who knows? But first thing they're suggesting to him is to transition. So they come in with a problem. I have issues with my gender. Solutions, transition. There needs to be a holistic approach to medicine, and to rule out everything. Like, somebody who's, like, really struggling mentally, they shouldn't be having a surgery like that. Like, they're not in the right mindset. And two, like, you're putting a lot of stress on the body, and that's going to impact them mentally as well. So that physical stress is going to impact you mentally.
Well, it was interesting because I was talking one time to a friend who had struggled with an eating disorder. And I was like, well, imagine that your therapist had said, oh, okay, then you should eat less. Like that, okay, yes, you're struggling with how your body looks now. You should eat less and you should not. And she just kind of got this horrified look on her face. And like, I think for the first time, the like reality of what saying that to someone who has a like mental health problem, which is probably tied to their physical health, is going through. And you don't just say, oh, yeah, good job, keep going. It's like, hold up, what's causing this? How can we help you? And I think it's so like mind boggling to me that we can see that for like depression and anxiety and eating disorders and all of these other things. It's like, okay, what, like, hopefully we can help you get to the root cause. But for people struggling with their gender, the immediate answer is, oh, okay, you know best. Let's keep going and down this path and like do something more radical. It's so frustrating.
It is frustrating.
um, okay, we can wrap up shortly because this has been it's been like an hour. But are there any misconceptions about detransitioners, like anything that you think that misunderstandings that people have that you'd like to dispel? Any myths?
I think the big thing about detransition is that, like, detransitioners are a diverse group of people,
Mhm.
diverse political, religious beliefs, and none of these are right or wrong. It's just, like, we are a diverse population, and I think the other thing too is that I think that it kind of, like what we were talking about earlier, is that we can get kind of pigeonholed into, like, oh, well, you just need to take responsibility for wanting this procedure. When it's just like, it's more complicated than that. It's like, well, yes, I requested this procedure, and there's a lot of corruption going on in the medical system that they're not looking into. Who's not a good candidate? They're not informing patients, no true informed consent. That this is just a really messy issue, um, and that detransitioners deserve better care, and they don't need to be told, like, oh, this was a part of your gender journey, to completely dismiss their experiences.
Yeah, for sure. And then my last question is that on Twitter, I've noticed that a lot of people who have detransitioned have a lizard in their profile. Can you explain? I believe it's a salamander is the actual, I guess, animal that you have adopted, like that detransitioners have adopted. Can you just explain for our audience why that is?
Yeah, so the salamander is about, it's about, like, recovery. It's about survival, really. So it's about like the idea of like the salamander regrows its tail and whatnot. So it's this idea of, you know, I know that's probably not the most eloquent way of putting it, but pretty much that it is really a survival aspect. It's being able to move on and, um, just live. And I think that there's a sense of hope in that. And that's really why it's been chosen as, I don't know about mascot, but it's been chosen as kind of like the symbol for detransitioners.
Yeah. And then the lizard's just the closest emoji.
It is the closest emoji. We don't have a salamander. It's kind of funny. Like I actually started looking at salamanders like for Detrans Help and such. And I was like, oh, none of them are actually green because we're so used to seeing the lizard as the emoji. That was just like what was closest
That's
and
funny.
what we had to work with. So yeah, that was kind of funny. But yeah, so that is why the green lizard is supposed to be a salamander. We're just going to pretend it's a salamander because that's what we have. So
Nice.
yeah.
Yeah. Well, thank you so much for being on today, Camille. This has been a wonderful conversation. And thank you for speaking out for people, offering help to detransitioners, for everything that you're doing.
Yeah, thanks for having me. I appreciate it.
This has been a wonderful conversation. And to all of our listeners, please like, follow, and subscribe. Check out the new ebooks that we have coming out and keep on living the culture of life. God bless.